Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Some good news as Nigeria expects to receive its first COVID-19 vaccines tomorrow. Nurses in Enugu State today commence three-day warning strike, demand payment of remaining 50% salary for November and full salaries till date. And the United Kingdom Prime Minister clears the air on concerns over vaccine lacking efficacy on Brazil variant. Nigeria recorded its lowest daily figure of new coronavirus infections, with 240 new confirmed cases reported last night by the Nigeria Center for Disease Control, bringing the total number of infections in the country to 155,657. This is coming at a time the World Health Organization is reporting an increase in infections in 58 countries. Nigeria's mortality rate has also been on the decline as the country recorded 2 deaths, the lowest daily fatality in over 6 months, putting the total at 1,907. The 240 new cases are reported from 13 states, including the Federal Capital Territory, with Anambra State recording the highest at 85 cases, followed by Lagos, 82, Osun 17, Ogun 10, Kwara 9, the FCT 8, Kano 7, Abia recorded 6 cases, Ekiti 5, Borno 4, Edo 2, Bayelsa 2, Kaduna 2, and River State 1. The discharges include 170 community recoveries in Lagos State, managed in line with the guidelines, increasing the number of recoveries to over 130,000. Ghana and Côte d'Ivoire today became the first countries in Africa to roll out their vaccines to frontline workers and the elderly. This is under the COVAX facility. According to the World Health Organization chief scientist, Dr. Sami Wathan, 11 million doses are being shipped to about 11 countries this week in the coming days. The Global Health Agency insists that science continue to show that the vaccines are reducing the spread of the pandemic, as they hope the vaccination campaign can get to everywhere. The global experts say health systems need to gear up to train, prepare, and of course give regulatory approvals, prepare cold chain storage facilities to receive the vaccines. Well, ahead of the receipt of the first batch of COVAX vaccines, the federal government is rolling out special strategy to track COVID-19 vaccination process. The strategy, codenamed TEACH, also hopes to enable government have a rich electronic database of all eligible citizens for vaccination. In the meantime, the WHO country representative, Mr. Walter Bolombo Kasadi, is warning against any form of complacency regarding other interventions, saying the country needs a combination of vaccines and these strategies to attain the needed immunity.
Nigeria has led an exemplary response to COVID-19. Nigeria has averted the catastrophe that was predicted by several models. And this is because Nigeria was among the first one to show how political leadership can translate into result. The first COVID-19 case hit Nigeria, find Nigeria with a strong background of preparedness. Ever since, Nigeria has refined its intervention strategies, adapting to WHO guidance. And one of those is the vaccination, now that new vaccines have been endorsed by WHO for emergency use list. It's really pleasant to witness the launch of the TEACH strategy just ahead of Nigeria receiving its first batch of AstraZeneca vaccine. It was rightly said, this year is about COVID-19 vaccine. But I would like to emphasize that vaccine alone will not do it. We will need to continue to adhere to public health and social measures until such time that we reach enough coverage to generate herd immunity.
Over in Imo State, the COVID-19 task force has lauded the federal government in her continuous commitment to curb the spread of COVID-19 in the country, especially as the federal government takes delivery of about 4 million doses of AstraZeneca Oxford vaccine. The task force disclosed this in Owerri, the Imo State capital, while speaking to Channels Television on the need for Imo indigents to discredit the conspiracy theory making the rounds about the vaccines and embrace the directives from the federal government. Meanwhile, a cross-section of Imo indigents have also been reacting to this development. Our correspondent Eita Kwekute has more.
Following the COVAX sharing initiative for equitable vaccine distribution, some countries with limited or no access to vaccines till date, including Nigeria, will finally be able to start vaccinating their health workers and populations at risk, according to the chairman of the Presidential Task Force on COVID-19, Boss Mustafa. The COVID-19 Task Force in Imo State has lauded this development, maintaining that it is a step in the right direction.
The vaccines, yes, will help us in building up antibodies so that we can fight against it. But still, it won't still take away the fact that some people who have had COVID-19 have not built up antibodies. All I would want to say is, if the government has seen this as being very good for us, we should all accept this, go with it, and do our best.
He also speaks on the need for government at all levels to ensure that there's steady power supply for good cold chain system that can help retain the potency of the vaccine.
Our electricity, the power supply should be okay because most of these vaccines need cold chain to keep it potent.
Meanwhile, a cross-section of Imo indigents has been reacting to this development. They want the government to do enough sensitization and also ensure that the vaccines get to all Nigerians, irrespective of their status or location.
I think it's the duty of the government and other agencies, other relevant agencies, to educate Nigerians properly so that they can come out freely to get the vaccine, to be vaccinated.
If they will do it in such a way that the poor masses will also get the vaccine, will also reach the poor masses, because I know that the vaccine might be tagged at a high price. And if they bring down the price such that the poor man can afford it.
Although the vaccines will help people to build antibodies against COVID-19, but experts say the arrival of these vaccines do not change the fact that the non-pharmaceutical protocols like the use of face masks, hand sanitizers, washing hands and keeping social distancing remains the best way to curb the spread of coronavirus. Eita Kwekute for COVID-19 update.
Staying in the southeast, Dr. Ike Chukwuobi, the Commissioner for Health in Enugu State, joins us right now virtually. Thank you for joining us on the program. I'd like to quickly begin by asking how Enugu State is positioning to receive its own batch of the vaccines.
Good evening, Millicent. Enugu State is preparing to receive its own vaccines. We have our own state primary healthcare development agency that usually handles issues concerning vaccination in Enugu. We have done a lot of extensive preparations. What is going on now is that with the help of National Primary Healthcare Development Agency, there have been, and the state government in itself, we have deployed cold chain equipment in primary healthcare centers and in secondary healthcare facilities. There's confirmation that with the National Primary Healthcare Development Agency that for the last mile delivery of the vaccines, we are actively preparing for this. Now, in conjunction with the National Primary Healthcare Development Agency and the Federal Ministry of Health, there are certain steps that are being taken and they involve planning Now, a lot of communication has started between the federal agencies and ourselves, and we are taking the necessary steps to put things in place to be able to receive the vaccines. Now, we understand that there is a lot of vaccine logistics that will be involved concerning getting these vaccines from the federal level when they come to the states. We are doing our own part as much as we can to be able to cope with the distribution of the vaccines. Now, a lot of interactions are still going on, and we're saying that Enugu State will do everything possible to be able to also receive these vaccines and get it to the people that are supposed to receive it at this time.
We understand that the frontline workers are first in line to receiving it.
Yes, frontline workers are first in line to receive the vaccines. Yes, that's the plan.
But what can you tell us about the complete doses and if they will be enough? And this is also the question of asking the numbers that you're getting, if it will be sufficient for all the frontline workers in Enugu State, for example.
As we are speaking now, there are a lot of discussions concerning these issues of numbers. We are actually collating the numbers of people who are specifically at the front line who will be getting these vaccines. Now, specifics about numbers have not been shared, but we are confident that when these specifics are shared and when we can, draw the lines on specific details, that we will ensure that those people who require to get the vaccines first will get it. The understanding is that the vaccine implementation for Nigeria will happen in phases. So what we'll do is we'll prioritize and then be able to get the vaccines to those people who are actually at the front line. The first line defense with the COVID-19 are the people that will get the vaccines. As much as possible, we'll try to implement that in Enugu.
I must quickly ask you before we let you go, and that is your reaction to the recent seroprevalence study by the NCDC that sort of put Enugu State alongside Lagos with the number of people said to have the coronavirus antigen.
What the seroprevalence survey actually confirms is what we have all known already, which is that there is community spread of the COVID-19 in Enugu, in Nigeria, and in the rest of the world. There is definite community spread. This seroprevalence survey was carried out between September and October last year. And by then, it was known that there was community spread. So what the seroprevalence survey has just done is just, to confirm it in a sense. And 4 states were used in the survey, and it just gives you a little idea of what is going on nationwide. So Enugu just happened to be one of the states that was sampled, but it gives you an idea of what is going on. That is why in the medical community, what we keep trying to say is that the non-pharmaceutical measures are best to avoid COVID-19. Prevention is still better than cure. So we keep trying to let people know that the behavioral changes are best right now. The hand washing, the face mask, the social distancing are key, and they are very, very important. And when vaccines come in, it will also join in helping to pull back, the movement of the COVID-19 impact in the country.
We'd like to appreciate your time. We notice you are in the car, but thank you so much for finding time to talk to us. Dr. Ikechukwu Obi, Commissioner for Health in Enugu State. Thank you.
My pleasure.
We have more on the COVID-19 update when we return. Please stay with us. Welcome back. Following the enforcement of COVID-19 protocols in Lagos State, there was mild drama at the police headquarters today as one of the arrested female fund seekers gasped for breath at the parade ground in the Ikeja area of the state. Over 170 of the fund seekers were arrested by the Lagos State Police Command Task Force in breach of compliance to COVID-19 protocols in the early hours of Sunday at the Cabana nightclub, Victoria Island. The Commissioner of Police explains that all these suspects will be charged accordingly.
glad.
Now, this one come. Despite all the efforts of the state government, despite all the policies being rolled out now, so most youths who are leaders of tomorrow still find it difficult to comply. Self-compliance is what matters most. So the ladies and gentlemen that are seen here now, they were arrested. So overnight on early hours of Saturday, around 2 a.m. and 3 a.m. at Cubana nightclub in Victoria Island. We have 172 inside one club. Inside one club. No social distance. Having the nose marks there. Accordingly now, they violated the law of the state, and the law will take its course. That is, as they are here now, so they will be charged to court. And whatever decision the court takes, so is what we are going to comply. The owner was not there. The owner disappeared. The owner of this owner will come. The staff that are arrested now are going to be charged separately for this. We are not just taking it because it takes you to tango. If they don't go there, the man will force them from their houses. If the man did not open the place, they won't go and bring it to the place. So both of them are liable.
And with less than 24 hours to the arrival of the COVID-19 vaccine, the Minister of State for Health, Dr. Olorinimbe Mamora, earlier today spoke on the preparedness and administration of the vaccines. Dr. Mamora says the vaccine will be administered in order of priority, while appealing to Nigerians to observe the health guidelines and that people will still be subjected to the COVID-19 protocol even after being vaccinated. He was a guest in our breakfast program, Sunrise Daily.
The first will be the frontline workers, health workers, because they are in the front line. They are facing the battle heavily, so they will come first. Then, secondly, we will look at the elderly, those above 60, 65, and particularly with comorbidities, that is, they have existing existing health conditions, high blood pressure, diabetes, heart disease, things like that. They will also be, in that group. And of course, we will also be looking at the strategic leadership, of the country. And then, of course, we will be looking at some other people, like people at the, point of entry, the border posts, managers and things like that. So this will be the order in terms of priority for now.
Meanwhile, nurses in Ondo State commenced a 3-day warning strike to express their grievances with the state government. The nurses, under the auspices of the National Association of Nigerian Nurses and Midwives, have rejected the payment of half of the November salary, demanding for full payment of their salaries as well as their COVID-19 allowance. All the nurses and midwives working in state-owned hospitals and health centres at the local government level are joining the industrial action. The nurses had embarked on a peaceful protest during which they gave the government 2 weeks to pay up their salaries. Well, joining us for more on this is Kehinde Olumiye, chairman of the association. He joins us virtually. Thank you for joining us on the programme.
Thanks, Millicent.
All right,
I am Olumiye Kehinde.
We appreciate your time. First, tell us who you've spoken to, who's listening to indeed some of the protests, the demands, and why, and what they've said.
Yes, the nurses and midwives in Ondo State embark on 3 days warning strikes after the procedural 7 days moratorium to the state government, stating clearly the issue of 50%, which is not admissible within the system now, and other allowances the government is owing the nurses and midwives. That is why they were protesting. And as it is now, we cannot go on full-blown strike, but we have to follow the procedure because we are an affiliate of a center, and we are trade union registered CUM professional with registration number 0011 is 011, domicile in Abuja in national headquarters. They have given us the go-ahead to implement the morning strike in accordance with the industrial labor law. That is why we are starting the strike midnight yesterday towards this morning, and it will end on Wednesday through Thursday morning. However, the government has started engaging us through the Ministry of Health, and the meeting has not even yielded the desired result. To get the desired result is for the government to pay 100%, nothing short of that. If you are taking less, that means you are not getting the true picture of what is happening in the system, even within the socio-economic structure of Enugu State. Per drop within the taxi fare now is 100 naira. So for the past weeks now, we are yet to take the salary. So nobody is even in a good shape or sound mind to go back to work.
All right.
Yes.
We appreciate your time, Kehinde Olumi, Chairman of the Association, as we continue to follow that story. Thank you for your time on the programme. Now, British Prime Minister Boris Johnson says people should not be overly concerned about the new variant of COVID-19 first seen in Brazil, found in the UK. He says health officials offer that it is not a threat to the wider public. Let's take a look at the global update.
The British Prime Minister has been speaking about the impact of the pandemic on the UK, saying there was no reason to think that COVID-19 vaccines were ineffective against new variants of the coronavirus. Health authorities had said on Sunday that up to 6 cases had been detected in Britain of the P1 variant identified in the Brazilian city of Manaus, against which current vaccines appeared to be less effective. Ghana's President Nana Akufo-Addo and First Lady Rebecca Akufo-Addo have become the first people in the country to receive their coronavirus vaccines today. The President, with the First Lady, Vice President and Second Lady, pledged to take the vaccine publicly to reassure citizens it was safe. President Akufo-Addo has called on people to ignore conspiracy theories surrounding coronavirus vaccines ahead of the launch of its nationwide inoculation campaign against the virus on Tuesday, March 2nd. Well, over in India, Prime Minister Narendra Modi today received the coronavirus vaccine as the country opened its vaccination program for the wider population. The country launched its vaccination drive on January 16, but it was limited to healthcare workers and frontline staff. Now, those above the age of 60 and those between 45 and 59 but have comorbidities can get vaccinated.
Continue to take responsibility. If you have symptoms associated with COVID-19, please visit one of the sample collection sites in your state to get tested. You can visit our website, channelstv.com, for more updates and a better understanding of the pandemic. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.